If you have toothache, sore or bleeding gums, troublesome wisdom tooth, tooth sensitivity, or other types of facial pain, you should contact your dental practice rather than your GP. We can investigate the cause and provide the best treatment and advice. Your GP cannot take x-rays of your mouth and does not have the specialist knowledge and facilities to sort out dental pain. Antibiotics do not work for toothache. The dental team can also help you and your family to prevent future dental problems with regular checkups and can answer any concerns you may have regarding your oral health. As a dentist, I am part of the primary care team. If you have a dental problem, your primary choice is to see your dentist.